Standard occlusion theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the second topic: temporomandibular disorder. Standard occlusion theory for TMD. 2. Temporomandibular disorder. Contents. 1. What is temporomandibular disorder? 2. Definition of temporomandibular disorder. 3. What is disease name? 4. Temporomandibular disorder and disease name. 5. What is diagnosis? 6. Low back pain and temporomandibular disorder. 7. Disease included in temporomandibular disorder. 8. Psychogenic disease. 9. Referral for psychosomatic disorders to other departments. 10. Occlusal disease. 1. What is temporomandibular disorder? Temporomandibular disorder was once referred to as Costin syndrome or TMJ syndrome. However, these terms refer to the same condition as what is commonly called temporomandibular disorder. In addition, over 20 different names can be counted, including both English and Japanese terms. Thus, the so-called temporomandibular disorder has been subject to ongoing debate regarding its name and definition. 2. Definition of temporomandibular disorder. In January 1991, at a seminar held by the Temporomandibular Joint Research Institute in California, it was proposed that the term for what was commonly called jaw joint disorder be unified as temporomandibular disorders (TMD). The panelists agreed on the definition. Temporomandibular disorders (TMD) is a collective term embracing a number of clinical problems that involve the masticatory muscles, the temporomandibular joint and associated structures, or both. As a result of this seminar, the unproductive debate among many researchers advocating various names and definitions for TMJ disorder subsided. Furthermore, this definition clarified that so-called TMJ disorder is not a specific disease name indicating a particular illness, but rather a collective term for multiple diseases presenting various symptoms around the temporomandibular joint. That is, it is a syndrome. 3. What is disease name? For disease names, internal medicine diagnosis serves as a reference. In internal medicine diagnosis, disease names are listed by the affected organ, and for each disease name, explanations are provided regarding its definition, frequency, pathology, clinical symptoms, physical examination, laboratory findings, diagnosis and differential diagnosis, and basic treatment principles. So-called temporomandibular disorder cannot be considered a single disease name, as it encompasses multiple disorders with different affected organs and pathologies. 4. Temporomandibular disorder and disease name. So-called temporomandibular disorder, TMD, as defined, is a collective term for multiple conditions, that is, a syndrome. Therefore, unlike disease names that indicate specific illnesses, TMD cannot specify the affected organ, the pathological condition, or differential diagnoses. Since the so-called temporomandibular disorder is a condition without a definitive diagnosis, it is impossible to diagnose temporomandibular disorder. In other words, temporomandibular disorder is used when the cause or pathology is unknown and a diagnosis cannot be made. For example, since we cannot make a diagnosis, we will provisionally label it as temporomandibular disorder, is the appropriate usage. 5. What is diagnosis? According to medical encyclopedias, diagnosis is defined as the correct understanding of the subject. It encompasses not only the disease name diagnosis but also the patient's surrounding environment, the background of the illness, its causes, factors influencing its course and prognosis, and various matters related to examinations and treatment. In case reports, one may encounter the phrase, diagnosed with temporomandibular joint disorder. Considering the definition of diagnosis, this phrasing, diagnosed with temporomandibular joint disorder, is incorrect. 6. Low back pain and temporomandibular disorder. In the past, within the field of orthopedics, all conditions presenting with lower back pain were collectively referred to as low back pain syndrome. However, with advances in diagnostic technology, diseases whose pathologies have been clarified are now being assigned appropriate names specific to their respective conditions. That is, diseases that can now be diagnosed are being separated from low back pain syndrome and given new, distinct names. Similarly, in temporomandibular joint disorders (TMJ), recent advances in diagnostic technology have clarified the affected organs and specific pathologies in several distinct conditions. 7. Diseases included in temporomandibular disorder. The chart in the upper right shows the diseases included in temporomandibular joint disorders. Diseases included in TMD can be broadly divided into psychogenic disorders and occlusal diseases. Psychogenic disorders are typically managed by psychiatry, psychosomatic medicine, or neurology departments, not dental clinics. Occlusal diseases is a collective term for diseases arising from malocclusion. Therefore, only dentists can diagnose and provide causal treatment for diseases included in occlusal diseases. In Dawson's functional occlusion, diseases clearly identified as arising from occlusal disorders include degenerative TMJ disorder, lateral pterygoid muscle disorder provisional name, and posterior disc tissue disorder provisional name. These will be explained later. 8. Psychogenic disorders. Psychogenic disorders included in temporomandibular joint disorders are conditions where psychological or mental causes trigger various symptoms in the temporomandibular joint area. When the cause of the disorder lies in mental or psychological mechanisms, treatment should be handled by psychiatric, psychosomatic medicine, or neurology departments, not dental clinics. Therefore, it is inappropriate for dentists to independently provide counseling or undertake diagnosis and treatment. In such cases, dentists should issue a referral letter to a psychiatrist, psychosomatic medicine specialist, or neurologist, and participate in the treatment as part of a collaborative medical approach with the referring physician. Dentists diagnosing or treating mental disorders violates the Medical Practitioners Act. 9. Referral for psychosomatic disorders to other medical departments. Regarding psychogenic disorders, the dentist will request an examination from another department. This referral request consists of patient information, request details, and findings/reasons. The request details section should clearly state the symptoms. The findings/reasons section should include the items and results of tests performed and details of previous treatments administered. It is particularly important to provide dental medical evidence demonstrating that the condition is not occlusal disease, in a manner understandable to the physician. 10. Occlusal disease. Another condition included within temporomandibular joint disorders is occlusal disease. Occlusal disease refers to a group of disorders within temporomandibular joint disorders caused by malocclusion. It is not a specific disease name. Guichet defined occlusal disease as the sum total of pathological processes promoted by malocclusion. The Japanese Society of Prosthodontics defines it as a general term for various pathological conditions caused by abnormal temporomandibular and oral functions resulting from malocclusion, such as premature contact. Standard occlusion theory for TMD. 2. Temporomandibular disorder is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 3. Occlusal disease.